Am I audible?
Yes, sir. Audible.
Okay. Can we start?
Yes, sir.
Okay. Good morning, friends, and welcome all the members of the team Reviving Nation, a wellness community, to this webinar on awareness and prevention of cancer. As you know, we have just celebrated 2 days back the World Cancer Day on 4th of February. The motto of this World Cancer Day was to make a cancer-free world and to create awareness among the general people and to educate them by the health professional, by the government functionaries, and by the fighters who have survived from the cancers. This year, the theme is close the care gap of cancer. We should close the care gap between the care, and so that they can live a happy life after their treatment, a quality life they can live. So before we go to details, we should know what is cancer. So cancer is a disease caused when cells of the body divide uncontrollably. We all know in our metric under metric classes, those who have studied the science in plus 2, then there is a cell division process in the body, which is controlled one. But in case of cancer, the cell divides uncontrollably, and the abnormal cells are formed. And these abnormal cells, they form a mass, which is called tumor. And this tumor can spread. First, it is a localized one, then it can spread into surrounding tissue and to the whole body. The main cause of the cell division, cell growth is changes in the gene, changes in the DNA occur. And कैंसर में occur to anybody. हर किसी को कैंसर हो सकता है. To any age, to any sex, to any race, any religion, any region, and to any economic status. किसी को भी कैंसर हो सकता है. So we all are a potential candidate of cancer. हम सभी कैंसर के पोटेंशियल कैंडिडेट हैं. हमको भी कैंसर हो सकता है. So we have to be aware of it, and we should know this. This is for this the World Cancer Day is observed worldwide. Then we should know what is the causes of the cancer. Cancer क्यों होता है? There are many causes. It is multifactorial. अनेक कारण होता है. The first cause is it is genetic. We know that there is a inheritance cause, inherited. There is if cancer is present in the family, there is a family history of cancer, then cancer may occur to the offspring, to the child, to the, and it is only 4 to 10% cases. In gene level, it is inherited from the father and mother. But maximum number of cancer are non-hereditary origin. So the DNA transformation occurs at a later stage due to various factors. And these factors are the physical and chemical agents. In environment, there are physical agents and also there are chemical agents. And they serve as a stimulants. They serve as a irritants to the cells and to our gene and DNA. And the most important cause is smoking. 30% of all cancers, the risk factor is smoking. So smoking is very, very dangerous. And in case of lung cancers, the smoking is a 90% causative agent. And smoking causes more than 14 numbers of cancers like mouth cancer, esophageal cancers, and many cancers of the alimentary canal, breast cancer. There is a tendency of e-cigarette smoking. It is also very harmful. I cannot go to the details. Passive smoking is also very harmful. Active smoking is very harmful, but passive smoking is also very harmful. There are carcinogen materials in the environment. We have studied our books in Robbins Pathology. It has written that we are swimming in an ocean of carcinogens. These are the heavy metals like arsenic, asbestos, benzene, beryllium, cadmium, chromium, ethylene oxide, nickel. Various types of carcinogens are present in the food, water, adulterated foods. We are taking it. There is a huge uses of pesticides to grow the crops, and in the environment there is pollutions like air pollution, water pollutions. The dust, smokes are there. They are the potential allergens which stimulate and irritate our cancers, our cells to grow and to cause the cancer. The most important causes of cancer is a lifestyle modification. In the modern era, a urban lifestyle, busy, hectic lifestyle, we are uh, we are living in a sedentary life. Maximum numbers of people are living in a sedentary lives. Many patients, many people are consuming alcohols. These are all risk factors. Many people are in a stressful condition. Anger, sorrow, and the work pressure, they are causing stress to our life. We are taking the unhealthy diet. Unhealthy diet is causing 5% of cancers. Mainly the non-veg diet, non-vegetarian diet, they are causing the colorectal cancers. The adulterated foods we are taking, they are causing also the cancers in the alimentary tracts. Then obesity, the body mass index, we all know more than 30. It is the risk factors of 20% of cancers, and it causes more than 11 numbers of cancers. So obesity is a major factor and major causes of the cancer. Then deviation from our normal life is a cause of cancer. Like we should sleep at least 8 hours, 7 to 8 hours. If we will not sleep adequately, then it is a risk factor for cancer. Menstruation is a natural phenomenon. Menstruation, in case of female, natural phenomenon. If will take medicine to stop the menstruation. Breastfeeding is a natural phenomena after childbirth. If we will not breastfeed our baby, then it is a deviation from the normal life. Early, if we do late marriage, in case of both male and female, if we do the late childbirth and less than 2 numbers of childs, these are all potential risk factors for cancers. There are various hormones in the body which is balancing our body like estrogen, progesterone, testosterone, histamine, cortisol, etc. If it increases of its threshold value, then it is a potential risk factors for cancers. In case of stressful life, the histamine increases, the cortisol level increases. Infection is also a direct cause of cancer, like human papilloma virus in case of cervical cancer in female, Epstein-Barr virus, hepatitis B and C viruses. Some bacteria like Helicobacter pylori can cause the stomach cancer. Inflammation like chronic diseases is a risk factor for cancer. And last but not the least, the radiation. There are two types of radiation. One is non-ionizing radiation. We are using the mobile phones. We are using the electric power transmission. UV radiation is there. These are the non-ionizing radiation. This is a risk factors of many skin cancers. Then ionizing radiations like the medical imaging like X-ray, CT scan, MRI scan, PET scan, and people living besides the nuclear power plants, they are getting the radiation injury. They can cause many skin cancer and organ cancers also. So these are the cause of the cancer. We should, if we know the causes, we can prevent the cancer. We can prevent the cancer. So now the time is how to suspect that as we all are a potential candidate of cancer. So how to suspect that we may suffer from cancer? The body gives a signs. Body gives some warning that you are going to develop cancer at a later stage. And there are at least 7 summons of warning signs. If we know it clearly, we can detect our cancer early, or we can stop the cancer growth. So there is a caution formula in our study, CAUTION, caution formula. So C, there is change in the bowel and bladder habit. Bowel habit changes, matlab constipation. If it not pass or stool clearly, it is called constipation. Diarrhea, if will pass the loose stool frequently for a prolonged period, then we can suspect this is a warning sign that we may later suffer from the alimentary canal or colorectal cancer. If the bladder habit it changes like urgency, there may be micturations, less amount or more amount, anything, then we should check, we should examine our body, we should go to visit the doctor. Then second, a sore, one sore or ulcer that does not heal for more than 7 days despite taking medicines. In mouth, there are we know the white patches are there. It is called leukoplakia. मुंह में छाले पड़ जाते हैं. The most people we know they are taking the pan. There is a deadly combination of chuna, supari, and gutkha. If we take all these three, or chuna and supari too, then it is a potential risk factor that it will first cause the leukoplakia, white patch. It will cause. Then after some days, the patch will be red. It is called erythroplakia. And the third stage is the cancer. So the precancerous stage is the leukoplakia or white patches inside the buccal mucosa. This stage we should stop the taking pan, gutkha, whatever maybe, and we should examine our mouth. Then third is the unusual bleeding, CAU, unusual bleeding or discharge from orifices. Our orifices are from eye, nose, mouth, from urethra and the anal canal. If there is bleeding or any foul smelly discharge, we should consult the doctor. In case of females, if the menstrual cycles, there is irregular menstrual cycle, there is mid-period bleeding, there is heavy bleeding, and bleeding during and after sexual intercourse, we should be very cautious. We should visit a doctor. We should do ultrasonography. Various tests are there. This may a potential risk factor, potential precancerous condition for cervical cancer. Then T, thickening. There may be thickening, or there may be a lump or mass in the breast. In case of breast cancer, there is a lump or a mass in the breast or elsewhere in the body, in the skin, below the skin. We should be, this is a warning signs that breast cancer or skin cancer may be there. Then I, indigestion or difficulty in swallowing. In case of indigestion, there may be some alimentary canal cancers. In case of difficulty swallowing, there may be throat cancer, esophagus cancer. So we should consult a doctor. Then O, in obvious change in what or mole. जो जाई होता है हमारे शरीर में, उसका जब साइज इंक्रीज करेगा, उसका टेक्सचर इंक्रीज करेगा, उसका कलर चेंज होगा, पेन होगा, दर्द होगा, तो दिस इज ए वार्निंग साइंस that skin cancer, melanoma, various types of skin cancers may be there. Then N, CAUTION, N, nagging cough or hoarseness of voice. If there is prolonged cough and voice is changing, hoarseness of voice, it is a symptoms of laryngeal cancer, lungs cancer may be there. So these are the 7 warning signs we should know. If there is unusual sign and symptoms like this, we should consult a doctor. We should investigate ourselves by consulting a doctor. But the common symptoms of cancer is there is anorexia. Anorexia मतलब भूख नहीं होना, खाना नहीं खाना है. Weakness, ज्यादा दुर्बल हो जाना, काम करने के लिए इच्छा नहीं होता. लॉस ऑफ वेट, ठीक वजन रहता होगा, हठात वजन कम हो जाएगा. एनीमिया, there is loss of blood, hemoglobin level decreases less than 7. In case of unexplained fever and diarrhea, ज्वर, fever, बुखार होगा, not responding to treatment for more than month, so we should suspect this is a symptoms of cancer. So after this suspicion, what we will do? We should visit to a doctor and we should be diagnosed. Diagnosis should be done. And in case of cancer, diagnosis is based on the clinical suspicion, the signs and symptom. What is the signs? What we are complaining of? According to their complaint, there is a clinical suspicion that cancer may be there. Then doctors do the X-ray, CT scan, MRI scan, PET scan. In case of breast cases, the mammography is done. Then some tissue are taken by FNAC, fine needle aspiration cytology, biopsy, and histopathological examination are done, and where cancer cells, the abnormal cells are there, their investigation was done. Then some immunochemistry, cancer marker cells are present in the blood. So blood examination being done, and some molecular test also done. And after this, the cancer is diagnosed. After the diagnosis, the cancer staging किया जाता है. तो कैंसर का 4 स्टेज होता है. इंडिविजुअल कैंसर का इंडिविजुअल अलग अलग स्टेजिंग है, पर एट ए कॉमन there are 4 stages of cancers disease. 4 stages of the disease. So stage 1 is if the cancer is limited to the organ, small organs, localized one, only जहां कैंसर सेल इनकी जो है वहां ये लिमिटेड होके रहेगा. तो it is stage 1. And in case of stage 1 cancer, the cure rate is 100%. So if we go early detection will be done, then cure will be 100%. In case of stage 2, if the localized, it will increase in size and it will be enlarged to whole organ will be involved. Then it is stage 2. Here the survival rate is 10 to 12 years and cure rate is 80% cure rate. And the first and second stage, this is the early stages. But in case late stages are stage 3 and stage 4. In case of stage 3, there is widespread metastasis to other organs done. If it is a liver cancer, then besides the liver, it will go to lungs, it will go to stomach and other organs. This is widespread metastasis. Beyond organ, it will spread. In this case, the 5-year survival is only 25%. And in case of fourth stage, this is the advanced stage or terminal stage. It is organ damage occurs, and the survival period is only 3 to 6 months if treatment not started early. So there are various types of cancers are there. Brain cancer, blood cancer, gallbladder cancer, stomach cancer, pancreatic cancer. These are having bad prognosis. ट्रीटमेंट करने से बाद भी इसका क्योर रेट बहुत कम होता है, ब्लड कैंसर, ब्रेन कैंसर जैसे है. परंतु अभी जो ओरल कैंसर होता है, मुख में कैंसर होता है, सर्वाइकल कैंसर, बच्चादानी में जो कैंसर होता है, वहाँ सर्वाइकल रेट ज्यादा होता है, प्रोग्नोसिस भी अच्छा है. तो advancement of the medical is there. So treatment is based on the rule of 20-80. There is a rule of 20 and 80. As I have already told, stage 1 and stage 2 is the early stage of cancer. And 20% of people, they come in early stages. Only 20% of people come in early stages, and the cure rate is 80%. But the PT is the 80% of people come in the late stages, that is the stage 3 and 4, and the cure rate is only 20%. So we should be aware. We should aware the people that they should come in early stages so that the cure rate will be more than 80%. They will cure. There are various modalities of treatment like surgery, ऑपरेशन करके जो वहाँ लोकलाइज्ड कैंसर होता है ऑर्गन को निकाल देंगे, सर्जरी. रेडियोथेरापी होते हैं, वहाँ एक लाइट पका जाता है, रेडियोथेरापी में रेडिएशन किया जाता है और कैंसर सेल जो होता है उसको नष्ट किया जाता है. केमोथेरापी, एंटी कैंसर ड्रग्स दिया जाता है और टोटल बॉडी को थोड़ा हार्म करता है. There are various type of targeted therapy होता है. Immunotherapy also a modality of treatment. There are hormonal therapy, genetic therapy, various therapy has emerged. Besides the allopathic treatment, modern scientific treatment, also there are alternative therapy we are practicing mainly in India, like Ayurveda, yoga, pranayam, chanting of Om, and the most important is mind control. Visualization should be done that I am healing, I am getting cured. This positivity, it will create it will cause healing at a faster rate, and the patient they will cure. So this visualization technique we are all using in our business strategy in MOA also. Then the palliative care usually done in case of terminal stages, in stage 4, when already there is organ damage. We cannot cure the patient, so we have to, whatever the period जो कुछ बचा कुचा है उसका जीवन में, we have to improve the quality of life of the patient. We should decrease the pain, remove the pain, suffering, bleeding, the sore throat. We should heal it. So this is the palliative care. This is given in the home and in the hospital setup also. So this is all about the treatment plan. But the most important is we should know what is the prevention of the cancer. हम कैसे कैंसर को रोक सकते हैं, नहीं, कैंसर हमारा बॉडी को नहीं होगा, हमको कैंसर नहीं होगा, इसके लिए हम क्या कर सकते हैं. As I already told, the most cancers are preventable, but up to 50%. 50% cancers are preventable. This is the called primary prevention. And rest 50% cancer, we can suspect early, we can diagnose early, and we can treat it if we detected early in the stage 1 and 2. So for the 50% cases, prevention, that is the primary prevention, we should follow it. So what are the preventive methods we should follow so that we cannot suffer from cancer? So first is we have to live a healthy lifestyle. हमको एक सुस्त जीवन जीना पड़ेगा. So for which the most important was is हमारा वजन, we should maintain a healthy weight. We all know that for healthy weight, we use the formula of BMI, body mass index. That is the weight in kg divided by height in meter square. If it is less than 25, from 18.5 to 25, then we are in a normal weight. And this normal weight, BMI less than 25, can lower the risk of 13 number of cancers. So in rehabilitation, we are using the God research program, and we are controlling our weight. So this is a very good thing. We are preventing the cancers. Then we should do physical exercise regularly. That is 30 minutes per day, 5 days in a week. We can run, we can walk, we can dance in our home, we can do swimming, we can play some games, we can go to a gym, but we have to do some physical exercise. Those who are not able to do physical exercise, they should live an active life. We should do our own works ourselves. When we are going to upstairs, we should use staircase. We should avoid using the lifts. We should limit ourselves in front of TV, in front of computers. We can attend the mobiles, not sitting but walking. This way we can be live an active life. We should avoid stressful life. We should be happy. We should celebrate the small happiness, small success can be celebrated with the family, with the friends, and we should be satisfied whatever we are doing in our job, uh, in our business. We should a positive attitude will help, will prevent from many diseases like cardiovascular disease, other diseases, and also this cancer. We may incline into spirituality. We can chant the name of the God, and most important is adequate sleep is required for the healing of our body, and we can reduce exposure to indoor and outdoor air pollution. There are various pollutants, and these pollutants are all carcinogens. So in the home, we can use the air purifier, atmosphere mini in home. In car, We can use the atmosphere drive in the car when we are going to a polluted area. We can use the mask. This way we can reduce the exposure to the air pollution. So healthy lifestyle is very much important to prevent cancer and also other diseases also. Then second most important is we have to follow a healthy diet. We all know in the God Reset program, we are eating the healthy plate in which the 25% consisting of the complex carbohydrates, 25% consist of the plant proteins, and the rest 50% consist of fruits and vegetables. We should give color to our diet so that our life will be colorful. So more plants uh, should be included in our diet than the animal, uh, not the animal. We should avoid the red and processed meat. Those who are non-veg, they can take uh, in place of red and processed meat, uh, moderate quantity of chicken. They can take the fish, but not the more fried one. We should avoid the simple sugar, refined carbohydrate, the bread made up of the maida or wheat flour. We should avoid the processed, packaged, fried food, fast food, also the sugar sweetened drink. In instead, we can use the green tea. You can use the coconut water. You can use the lassi. We are taking the fiber water uh, in the program also. We should avoid the refined oil. These are the chemicals we are using, not the oils. Instead, we can use the olive oil, canola oil, the mustard oil, coconut, groundnut oil in moderate quantity we can use. And the most important is the intermittent fasting. Intermittent fasting is very, very much beneficial for prevention of the cancer. In our book, it is in our old text. It is written that Langanam Param Aushadam, meaning fasting is the best medicine. One Japanese cell biologist called Yoshinori Osumi, he got Nobel Prize for his research work autophagy. Autophagy means when we will do fast twice in a month. Our the Indian age-old practice was fasting in the Ekadashi. They will not take any food. निर्जला उपवास उसको बोलते हैं. So in this case, what happens? Only the healthy cell will survive, and the unhealthy cell, those will depend upon food. They will get rid of it. So the body, there will not be any abnormal cells. The abnormal cell will destroyed by this intermittent fasting. So intermittent fasting should be done twice in a month. Our age-old practice of Ekadashi, this should be followed. Then the third most prevention is those who are doing smoking, they should stop smoking. Those who are taking the tobacco, pan, gutka, they are taking, they should stop the chewing of the tobaccos, because in the tobaccos and in the cigarettes, ganja or BD, there are deadly carcinogens, and these are the 30% of cases, 30% of cancer are due to smoking and tobacco uses. But you should stop smoking and you should stop chewing tobacco. Then We should limit the use of alcohol. In the name of social drinking, many people are taking alcohol. So zero is the best. Otherwise, in minimal, moderate quantity, we should limit the alcohol use. Then we should protect ourselves from the sun exposure. Sun exposure. Usually, the peak burning time, sun burning time is 10 a.m. to 4 p.m. So this period, 10 a.m. to 4 p.m., this 6 hours, we should avoid going outdoors or direct exposure to sun. We can use umbrella, and the best thing is we should use sunscreen lotion. At least SPF 30 we should use to protect our skin. Then we should protect ourselves from STD, sexually transmitted diseases. The as I already told, the human papilloma virus, hepatitis B, and HIV virus are there, for which we have to do the practice. We should practice safe sex. We should be mutual and faithful to our partner. And there are vaccination is there against the human papilloma virus from 9 years onward up to 16. Then it is extended to 26 years. Those who are below 26 years, they should take the human papilloma virus vaccination. Recently, WHO has extended the age limit up to 45 years. So all the females, they should, women, they should be taken vaccination against this human papilloma virus. Then, after childbirth, the woman should breastfeed her baby, because in case of breastfeeding, it will reduce the mother's cancer risk of the breast. We should follow it. Then we should do marriage at the right age, and childbirth at the right period. And the most important is we should not tease our body. We should not tease our body. We should not take pills to control menstruation frequently. We should not take hormonal replacement therapy. This should be followed. A normal life should be lived. Then we should take judicial use of vitamins and supplementation. We can take, there are 10 to 12 numbers of vitamins and supplementation are there, which has proven benefits for prevention of the cancer and to halt the progress of the cancer, which is prevent the growth of the cancer cells. These vitamins we should take judicially under guidance of a proper health personnel. And these medicines, these supplementation are enzyme Q10. It is a very potent antioxidant drugs, and it is a very much energy source to our body. Breast cancer, in case of breast cancer, it is very much helpful. Then the omega-3 fatty acids, it is also helpful. Then the isoflavones are flavonoids, mainly present in the green tea and other fruits. These are also helpful antioxidant properties there. This resveratrol is a very potent antioxidants. It will delay the aging process of our body also. The milk thirstil, which is useful in case of liver diseases and slow the liver cancer growth. Then the anti-homocysteine vitamins like B vitamins, these are also helpful in case of various diseases. Then vitamin E supplementation is useful for skin. Then probiotics, uh, it is a protective of our digestive system. Then N-acetylcysteine and glutathione, this protects our lungs and somewhat in liver also. It is a very much potent antioxidant and prevent the free radical damage of our cells. Then some modified cytospectin MCP, then calcium glucarate and CLA conjugated linolenic acid. These are the some vitamins and supplementation have some beneficial effects to prevent the cancer. These are the all the primary prevention. If we follow the healthy lifestyle, if we take the healthy diet, we will stop smoking, stop alcohol consuming, then protect ourselves from the sun, from infection, sexual transmission infection. Then we can cancer will not attack ourselves. Then the next thing is the secondary prevention. Secondary prevention, for which secondary prevention, we have to do screening our body regularly. Screening, we should do some test. We should examine our body ourselves or by a health professional. And the screening of cancer is age specific. So in case of less than 20 years, the cancer is very rare, very rare. But after the age of 20 to 30 years, all the female, all the women, they should do pap smear examination for virus from the cervix of the uterus. The cervical mucosa is taken with the help of a stick and it is examined under microscope. And some chemicals are used to detect whether the virus is there, HPV virus is there. So every 3 years, we should do pap smear to diagnose ourselves, diagnose early for cancer of the cervix. In the age group of 40 years, the woman, the female should examine, the self-examine their breast. And the ideal time of self-examination of the breast is middle of the period. And they should examine their breast every month in front of the mirror with a flat hand. They can feel whether the constituency, the breast constituency is soft or not, or any mass is may be done in case of any mass or in case of feeling any hardness in the breast. And mammography should be done every year. Then test of, in case of male, prostate cancer is common. So some test, the PSA test, prostate specific antigens test should be done every year. In the age group of 45 years, the colonoscopy should be done, sigmoidoscopy should be done, endoscopy may be done to know the colorectal cancer, eliminate tract cancer. In the age group of 50 years, lung cancer is common, so CT scan may be done. In case of cough, CT scan may be done. So these are all the screening tests done to detect early in case of cancers. So I have discussed all the all that should be known to us, and we can go to the people, we can go to the public to aware them. So this webinar session, the conclusion, the take home message is, this is the right time. This is the right time. We should love ourselves. खुद को हमें प्यार करना होगा. We should love our body. हमारे शरीर को हमको प्यार करना पड़ेगा. और we should love our family. और हमारा परिवार को प्यार करना पड़ेगा. हमसे हमारा परिवार है, परिवार हमसे है. For which we should the obey the healthy habits. और वही preventive method है, प्रतिरोध है. Prevention is better than cure. Then the 50% cases prevention, we can cancer is preventable 50% cases. For the rest 50% cases, we should screen ourselves. हमको स्क्रीन करना पड़ेगा. जो साइन बताए थे, जो सिग्नल, जो वार्निंग सिग्नल बॉडी में देता है, कैंसर होने से पहले कैंसर ऐसे हठात नहीं हो जाता है, सडनली कैंसर नहीं हो जाता है. उसके पहले बॉडी हमको वार्निंग साइन देता है कि तुम्हारा बॉडी में चेंज हो रहा है, संभल जाओ. तो वार्निंग साइन को जब आएगा उनको नजरअंदाज नहीं करना चाहिए. एंड वी शुड स्क्रीन आवरसेल्फ. जो स्क्रीनिंग टेस्ट दिया है, डॉक्टर के पास जाके हमारा ये दिक्कत है बोल के स्क्रीनिंग करना पड़ेगा. And cancer is detectable, cancer is curable, cancer is manageable if it is detected early. So this webinar we should be serious enough. We should take the advantage. We know the cancer. What is cancer? We knew the causes of the cancer, and we knew the signals, the warning signals of cancer, and how to prevent the cancer. So this is all from my side. Thank you for the great listening.